Our next speaker, Ms. Jasmine Boykin, is going to give us is a licensed professional counselor, and she's going to kind of discuss this a little bit. Her approach has been to focus on the safety, well-being, and inherent strengths of her patients while building resilience and coping strategies tailored to their unique journey, cancer, and other illnesses. Today, Ms. Boykin is going to be talking about coping with stigma, breaking down barriers, and mental health interventions as far as lung cancer. Ms. Boykin. Come on.
Good afternoon, everyone. So today I'll be talking about maintaining good mental health on your journey through lung cancer. And just to emphasize, I do speak with patients every day who are navigating something similar that you're navigating. So I'm honored that I get to talk to you today. And throughout this presentation, this is about you. This is for you. Okay? So, before I begin, I really want to talk about the emotional reality of a cancer diagnosis. So, I want you to think back when you were diagnosed. What are some of the emotions that came up for you? Was it scared? Yes, ma'am. I could imagine. Thank you. Scared? Anybody else would like to throw something out? Yeah, scared. Yes, ma'am, Ms. Morales. Yes, ma'am. Were we sad? Did we go through some type of depression? Yes, ma'am. Were we angry? No? Okay. Maybe some people are angry. I hear anger is something. Guilt or uncertainty throughout our treatment. These are just some of the common things that I hear. So let's talk on anxiety and fear since somebody was very brave enough to express that they were very anxious and fearful. So that can look like waiting on scans results, sitting at your doctor's office wondering if the treatment is even working. Lying awake at night, 2 o'clock in the morning, we have these worrying thoughts like, what does my life look like now? Look how much my life has changed. Miss Morales talked about earlier how she was just a regular person going through life. All of a sudden, she gets hit with a cancer diagnosis. My goodness, right? Those are very common things that I hear every single day, and it affects most people with this diagnosis. And you're not alone in this. This fear and anxiety is your nervous system responding to a real actual threat. Sadness. I heard some people say they struggle with sadness or depression. Grieving the life you had before. Grieving that life of just getting up going before your body even knew cancer or knew what this cancer diagnosis was, or just realized how much your life changed in an instant. Missing a version of yourself or who you were before this cancer diagnosis, right? Losing the ability to do the things you enjoy, or what Miss Morales said earlier, you losing that independence, trying to figure out what does life look like now, feeling like you're a burden on the people you love the most. This sadness is real. The depression is unfortunately is very undertreated, but it's very treatable. This feeling is not weakness. This is loss. Anger. I didn't hear a lot of people say anger, but I do hear a lot of my people say that they get angry, and it's okay to be angry. Anger at your body for getting sick. Anger at people who say the wrong things, what Ms. Morales said earlier. Some people even get angry at God. I hear that a lot too. At the unfairness of it all. Having to fight so hard to live. Goodness. And unfortunately, anger is often overlooked. But it's that part of us that love us so much and they realize that none of this is fair. And that deserves validation. It deserves space as well. Anger is also the other part of grief. Guilt and uncertainty. Guilty about smoking history. As previous presenters said before, you didn't want this, you didn't cause this, it just happens. Guilty about being a burden on your family. Asking what would happen if I caught this sooner? Living with the uncertainty of what comes next. What about the next scan? What if I relapse? What if I figure out that the treatment isn't successful? What's next in my next season of life? What about the future you plan? Unfortunately, with cancer diagnosis, it asks you to live with a lot of unknowns, deep unknowns. It's one of the hardest things a person can ever do or being asked to do. But once again, you did not choose this. The guilt is not yours to keep. Something I want to touch on is dealing with toxic positivity. People want to help. People do not know what to say once you get a cancer diagnosis. Amen. Yes, ma'am. They do not. So I'm going to say some common things I hear people say, and I am going to give you some things on what can you say in response. For example, stay positive. Your attitude is everything, right? We heard that before? Okay. This does not leave, this implies that you or your emotions can cure or cause your cancer, which we know that's not true. And that doesn't leave you with any room to express how you really feel. So, what you could say is, I appreciate that. But right now, I'm just trying to take things one day at a time. Okay? Everything happens for a reason. That's what they say. Yes, ma'am. This can really diminish your real suffering. Cancer is not a lesson, it is not a gift, it's a diagnosis. So you can say, that's okay. You don't have to fix it. I just need you to listen. Right? That's what you go to the doctor for, to kind of figure things out. You are so strong. You got this. Okay? What if you don't want to be strong all the time? What if you are just barely making it? That's okay. That is okay. You can tell them some days I'm not strong, and that's okay. I know somebody who beat this. Okay, but you're different. Exactly. You are different. Well intentioned, but it does minimize what you're going through and puts the pressure on you to have this exact outcome that somebody else had. You can tell them, thank you. I appreciate that. I'm so happy for that person, but I'm focusing on my own journey right now. Okay. At least it's not, or like Miss Morale said earlier, you're still here, right? Comparative suffering does not help. It does not help. It is not helpful. Your pain does not need to be compared to somebody else's pain to be real because your pain is real. Yes, ma'am. So you can say, this is hard. And I'm letting myself feel that. Okay. Unfortunately, with lung cancer, your relationships change too, right? Some people who were really close with may have disappeared. Some people might become overprotective, overbearing, won't let you breathe, telling you all the things you should be doing. Role shift, what if you were the person who were the caregiver and now you're being taken care of? Or what if you were the provider in your family and now some people have to provide for you? That's very hard, very hard to adjust. Intimacy and connections might change. People who, how they interact with you might change. Friendships might not can hold that weight of a cancer diagnosis. And also, new people might come in your life you haven't talked to in a long time, and they come and they want to be there for you. So, why does this happen? Because people are afraid they're going to say the wrong thing. They're afraid they're going to say something, you're going to spiral, right? Sometimes people be afraid because they get to think about their own mortality. People don't know what to say, so they kind of just avoid. Caregivers struggle with their own grief. Relationship dynamics never been tested like this, right? We don't know how our friendships are strong until we go through something like this. Some people love, they just don't know how to show it. So what can we do to help? We can name specifically what do you need from people. Give people a job. Most people do want to help. How many times do you hear the phrase, if you need anything, just let me know? Mhm. All the time, right? all of the time. Use it. You know what? I'm so glad you said that. This is what I need. Give them that role. They offer, right? So give them a role. Give them something to do. Okay. Release the guilt. The guilt. You do not have to be everything to everybody all the time, right? It's okay to focus on you. Focus on your healing. Sometimes people are just in your life for a season, and that's okay. That is okay. The new ones that come in who want to help, let them, right? Let them. Let them show you how much they love you by helping you. And also consider counseling because I'm a therapist. I'm always going to put in counseling. Okay. And I am going to repeat this. You do not have to feel strong all of the time. Okay. I'm going to say it again for the people in the back. You do not have to feel strong all of the time. Your fear is normal. Your sadness is normal. Your anger is normal. Your everything is normal. Whatever emotion you are feeling, that is okay. With with lung cancer, it is the most destabilizing thing a person can experience, and your emotions are not a sign of weakness. Okay, your mind and your body is connected. When we take care of our emotional health and our mental well-being, your physical side effects can also improve. You are more than your diagnosis. You are not just a cancer patient or somebody with lung cancer. Your values, your relationships, your identity do exist alongside with this cancer diagnosis. You are a whole person. You're not just a patient. You are not a statistic. You don't have to be in the assembly line with the doctor. You are a whole person. So, what are some things she can do that can help? Rest without guilt. Since I know that Antioch is also a part of this, I like to use this biblical phrase. If God, who have created the heavens and the earth and the animals and the trees and the plants and everything else, he said that was good. And what did he do afterwards? He rests. Okay? He rests. If God himself need rest, you need rest too. Okay? Movement. Dr. Sanders said this earlier. Movement, even if that's just a short walk, a stretch, that can also help regulate your nervous system. Making meaningful connections, a call, a hug, talking to somebody, relieves our stress. Moments of still, just be in the present moment. Breathing does wonders. Also help us not worry so much about the future. And a question I want to leave you with is what is one thing that still feels like me even right now? Even in the midst of my cancer diagnosis and all this I got going on, what still feels like me? So what about my caregivers? Reverend Brian also discussed about some of the things he was going through as he's a caregiver. My caregivers, y'all carry an invisible weight, right? Y'all needs matter too. So I'm gonna go through some of these briefly. Fear and anticipatory grief, that's mourning before the loss. This could be mourning of your loved one's life before your cancer diagnosis, mourning your life before your loved one's cancer diagnosis. Exhaustion because you are the strong, tough one, right? Guilt for having your own needs and feelings. Social isolation because your whole worldview has been narrowed down to being a caregiver. Anxiety about medical decisions, wondering if what I'm doing is this helpful for my loved one? Am I helping making these right decisions? Suppressing your own distress to protect you. So what can y'all do? Y'all can give each other permission to feel without trying to fix. Being that listening ear, saying, "Hey, this is hard." Naming what you need, not assuming. Letting the caregiver accept their help. Encouraging caregivers to seek support. Creating small moments of normalcy, whether it's eating lunch together, whether it's watching TV on the couch, something normal that's not centered around cancer diagnosis, and also counseling. So breaking down these barriers, I kind of went through these, but I'm gonna go through them again. Staying positive, you don't have to. You can be honest about your feelings. Hiding how you feel. You are allowed to have a bad day. It's okay. Blame or shame around smoking history. Once again, you are not to blame. Shame does nothing. Shame does not benefit you at all. Fear of being a burden to your caregivers. You can ask for that emotional support. It's not a sign of weakness, it's a sign of just being human. Pressure to fight when some days you just want to survive. Guess what? You get to decide what your fight looks like every day. Nobody has that right. You get to decide what your fight looks like. So, what actually helps? When you have those difficult thoughts or emotions, it's just thoughts. Thoughts are powerless without action. Once you put action into those thoughts, that's when it gets empowered. What do you want to be doing this? What relationships you want to tend to? What brings you meaning? And what small step can you do to help you live? Because that's what Miss Morales said too. We want to live. Okay. Breaking down barriers, counseling. You don't know where to start. Ask your oncology team. There's financial assistance for that. Telehealth exists. I do telehealth counseling, so it's in your packet. My information. You don't have to be strong. It actually makes you more present. And I will leave this closing thought. Your illness is just a chapter. You are still the author. Your story is still being written. Thank you so much for letting me be here today.